Hello, good afternoon, and salam alaikum to all the viewers today on our webinar for orthopedic and sports injuries. Dear viewers, first of all, I would like to thank you all for joining us today because we are conducting a very important seminar or webinar today, which will be we have some very special, very highly trained orthopedic surgeons with us, and this would give an opportunity to all the viewers to come forward, ask your questions. You can have consultations with us. You can teleconsult them. You can come and visit them. I will give you their details. Without further ado, I would like to start. Let me introduce my first speaker. We have a surgeon, orthopedic surgeon with vast experience in orthopedics and trauma care. He has worked with a lot of NGOs. He has personal interest in conducting camps globally. He has been to Africa. He's been to India. In Dubai, he has done a lot of surgeries. Very renowned, published author of knee injuries books, and he worked at Rashid Hospital at Trauma Center. He was there for a while. He's joined us now. He takes special interest in knees. And at the same time, this doctor is a philanthropist. He is a mountaineer. He has a history of traveling globally to mountains. He has a campaign called Let's Walk Again. Dr. Azam Badar Khan, he is with us today. Dr. Azam Badar, salam alaikum and welcome.
Walaikum salam, Dr. Ahmad. Thank you for an excellent introduction. That's my pleasure. And we'll have a webinar, and whatever my knowledge has, I will try to express it through this webinar.
Thank you. Viewers, the next orthopedic and trauma surgeon is a very familiar face. A lot of people have seen him. Family members have come to him. He is very calm. He's very composed, extremely intelligent, a very brilliant orthopedic surgeon. He trained in UK. He's done his masters there. He's worked there for a while. He has trained in knee and orthopedics, in trauma care. He's joined Prime since 2015. He's got a very good hand. He's he's very skilled with his hand when it comes to orthopedics and trauma. One of our favorites and an extremely brilliant orthopedic, Dr. Sanjay Sureen. He will be joining us today.
Hi, good afternoon, everyone.
Good afternoon, Dr. Sanjay. My first question, as you all know, the topic today is joint injuries, sports injuries with knee replacements and knee injuries. We at Prime here conduct a lot of total knee replacements. We do a lot of these surgeries. The specialists today on board with us are well trained, very familiar with these joints, and they've done a lot of these surgeries, trauma to the legs, trauma to the arms, shoulders. But I would like to place this session in two parts. So I would like all the viewers to understand that the first part of our webinar will be dealing with the knee injuries and knee replacements and all sort of illnesses related to the knee joint. And then the second part will move on to the sports injuries, which include all sorts of other orthopedic conditions. So I would like to start. My first question would be to Dr. Sanjay Sureen. Dr. Sanjay, if you can give a little introduction on the importance and what is knee replacement or total knee replacement? What are the conditions that can that require these sort of surgeries?
The knee replacement surgery is mainly done for the pain, and the knee is a very important joint of the body while you are moving about. And when you have suffered from injury or degenerations, you will need something doing. There are many things before actual joint replacement surgery, but you reach a stage where other treatments are not helpful and you need knee replacement surgery. Knee replacement is replacing the part of your knees, both the leg bone and the thigh bone and the kneecap. And we put in a metal part and the plastic implant inside so that you can move the knee. And doing so, we will remove your joint and replace it with the artificial joint, taking away the pain, and you can move about better.
Can I reply to it? Can I put a
Absolutely,
sentence to it?
absolutely.
Yeah.
Dr. Azam, I would like to ask. Yes.
With your permission, sir, I normally will tell my patient a very simple thing to make them understand that, see, the way we put on a tooth the cap, it's something similar. We just try to open the knee, just try to shave off the worn off part of the lower part of your thigh and the upper part of your leg. Just put a cap over there, put a plastic in, so that there is no bone and bone touching, there is no pain, and your knee is back to normal as it is. That's all.
Right. Right. Thank you. Dr. Azam, let me ask you this. Are all parts, all joints of the body can be replaced?
There are more than 300 joints in our body, but basically when we are talking about the joint replacement, we, as an orthopedician, we are talking mainly about the bigger joints like the hip, knee, shoulder. These are the more common joints which are being replaced very frequently, but then other joints are also done. And let me tell you that when it comes to knee, the data is that in the next few years, we are looking forward to do more than 4 million knee replacement throughout the world. That's the data which comes from the US.
Right. Dr. Sanjay, what is your take on the joints in young people versus adults? Is total knee replacement specific treatment or surgery done in old age, or do you have any information about youngsters or any specific other conditions, Dr. Sanjay?
The joint replacement is indicated mainly in the older people, but it is done in the younger population also. In the younger populations, we will do a joint preservation surgery. That means that we try to preserve the joints of the younger person so that they can live longer. But sometimes it is unavoidable. So even in the younger people, we have specific implants, we can use it, and it is done in the very young age. Even now in Western country, they are even doing teenagers also having a joint replacement. But the disadvantage is that you have to revise it as they grow older.
So what material is this implant made of, and is it compatible with everyone?
It is the metal, the titanium and stainless steel 316L, and specifically manufactured for surgical implants. And then the plastic is a very high density polyethylene, which is not commercial. It is medical one, which is not available in other places, only for the medicine use. And they are fixed in a specific way.
There are so many advancement in technology as far as the implant which has been used. As Dr. Sanjay said, there has been a lot of hybrid implants which have been coming and which are more compatible, more lightweight, and more stronger. So that's why we are seeing that in today's world, like the knee replacement. Earlier, when the knee replacement was being done, there were restrictions in certain movements. We could not have a high flex. High flex means that when you are able to bend your knee more than 90 degrees, which is possible because of these slimmer and stronger implants. And plus, you will be surprised, our viewers will be surprised to know that we are doing joint replacement with the high flex implants where it allows you to pray. Bend your knee to 120 degrees, 130 degrees, where you can sit for your salah or namaz, for your puja, for your anywhere. So you can sit with your folded legs and where you can pray. So that's the beauty of these advancement in the implant and today's technology. It has been changing very fast, and people are going back to their well. Again, there are certain factors which are involved. Who all can go after the knee replacement, can do their all normal activities. There is two things which is involved when we are talking about knee replacement. The alignment of the leg, and the second part is how much is the range of movement you are getting back. So, well, we guarantee that once we do the knee replacement, the knee as such, the implant is 100% normal. The knee gets normal. The range of motion also is normal, because when we operate on the table, we make sure that the whole movement is there. But there are certain factors before and after the surgery. How much was your limitation of the muscle, weakness? These factors come into play. Whereas at that point of time, patient physiotherapy and their own individual will to do the exercise plays a very important role to have a very successful total knee replacement.
Right. Dr. Sanjay, my question to you is, uh, can any person get a knee joint, knee replacement, total knee replacement? As in, is there any specifics to the size or the shape of the body? Or if there is an indication, are there any considerations in these?
No, except for some deformities, we can adjust the implant, but most of the time we have got various size and the shapes in the theater, different size and shapes. We have to measure it before. We have to see the X-rays. If there's a need be, we can get the special implants also made or special cutting instruments made. But mostly we have all the size and different implant, so that we can change it in theater. We just adjust according to the bone. After cutting the skin, we measure it and then fix the appropriate implant. So every size is in the theater with the different instrumentations, and we adjust it according to the patient size.
So, Dr. Sanjay, on a scale of 1 to 10, how complicated is a knee replacement surgery?
Knee replacement is not that complicated, but you have to have experience. It is not that straightforward also, not for everyone, but it is with the experience, you can give quite a successful result.
And
can I,
Dr. Azam?
Dr. Hamad, when we were talking about, Dr. Sanjay was telling about the cuts that we make and how difficult, as you asked, for a difficult condition of knee means there is a very myth, or I would say that there is a misunderstanding among our people that the more joint gets bad or arthritic, the degree of arthritis, if it is advanced and worse than advanced, then probably once you do the knee replacement, then maybe you will not have the perfect knee after that. No, that is absolutely a wrong conception. What I would like to say that, well, apart from the conventional knee replacement, what we do, we have varied, there are other tools which helps us to get the perfect knee replacement, in the sense that we have robotic total knee replacement. By Alhamdulillah, we did a successful total knee replacement with robot assisted in Prime Hospital a few months back. And then we have also been able to do customized patient-specific knee replacement. So, well, when the knee is difficult, when there is a lot of deformity and ligament laxity, then we try to this customize total patient-specific. The word itself goes that customize means we manufacture the implant according to the shape, size of the patient's knee, which takes a little while, where we have to take an MRI of the hip, knee, and ankle. Again, I'm repeating, we are doing knee, but to get the perfect customized patient-specific, we have to take the MRI of the knee, hip, knee, and ankle. We send to the company back in US. They take 1.5 months to manufacture it. I'm not saying we are getting it. They manufacturing means they make a cast. They make a same size of implant, and they send it across to us with a jig. So things are there in robot. Again, the same thing happens, that we just open it. We leave the calculation of how much we need to cut, how much is the worn part, and how we will get the alignment according to the robotic calculation. We do the mapping of the knee, like you know what is mapping. Like mapping is we just put the probe on the knee, and it gives a signal to the robot, which is catching the signal, and it tells us that you have to cut this much, 5 mm, 10 mm, whatever they say, and it stops your hand from cutting more than that. So the beauty of all this robot and customized totally is that implants are that we can have a high degree of accuracy when we are doing a knee replacement. So the chances of failure is absolutely nil.
Right, right. Dr. Sanjay, what are the special considerations after the surgery, and what sort of complications can people expect once they do the surgeries? Because people are really scared when they hear about prosthesis or titanium metal ball and a metal rod in their knee joint. They are quite scared and skeptical because it sounds that they will walk differently. Will they be able to get back to their routine life, at least the necessity part of their life? How does that work, Dr. Sanjay?
Main aim of the surgery is pain relief and mobility. So that is assured, and this process has been ongoing for last 30 to 40 years. So outcome and the satisfaction of the function is quite highly achieved. It is already proven that one. There are risks associated with any surgeries, especially knee replacement surgery. There can be infection, there can be clot, embolism, stiffness, there can be breakage of the bone, there can be injury to the nerves and other things, but they're not common. They're not common because we take all the precautions. Instrumentations are manufactured like that. You have been trained to do that one. You cannot do the knee replacement just for one. Like I want to do that today. You want to go to the theater and do that. You can't do that. You have to have the experience to do that. You have to train it for long duration to do that. So we take all the precautions and then take along with the patients, explain to them. We have to see the patients before to make sure that the complications do not arise. We understand the patient's specific conditions over there. So there are risks of surgery,
yes,
but
yes,
that is optimized, that is naturalized over there, and we try our best. And we have not had that risk factors developing post-surgically. Yes, you have to have the rehabilitation period. It takes some time for them to get back to the normal pain-free movement, but it is achievable and it has been achieved.
And is it always done on both the knees together? Are there cases where it can be done single joint?
Requirement and the patient suitability.
Okay, so yes, there are cases some people can come and say that I had specific changes or a specific trauma to my knee, and now I have difficulty in walking and I require one joint. So that is also a possibility?
Yeah, we prefer there is one joint is done, but both joint can be done also. That all depends upon the patient requirement and suitability. See, the bilateral joint replacement is quite an extensive surgical procedure. They have to be medically fit. If they are not medically fit, then they can't take the stress. So sometimes there may be a limitation, but there's commonly bilateral knee replacement, bilateral joint replacement, commonly done.
Doctor, see, when we ask, most of our patients will, as Dr. Sanjay will agree, that they, with all this apprehension and the myth that knee people, out of 100, they have seen one patient not walking normally. We don't know where that patient has gone and got the surgery done. Who is the surgeon? What happened? Why is the patient not able to walk? So when they ask me that, will my knee will it be normal after the surgery? I will say yes. Your knee will be normal, and your range of motion will be also. You will get a nearly 100% range of motion. But there are certain factors which is there during the process of your osteoarthritis. It does not happen within a year. It takes 5, 10, 15 years, especially when we are talking about osteoarthritis. During that period, it's not only your cartilage which has been worn off, it has given effect on your muscles around that area, ligament around that area, which is holding your joint. So when we operate, we are changing your knee. We are making it 100% perfect, and we guarantee that you will have a full range of motion, depending how much effort you are going to put after the surgery, how much muscle strengthening, how much range of motion, these things you will take. It is so these disability there. So these factors can be very well taken care by the patients if they are serious about it. What happens, unfortunately, after the surgery, we have done a perfect job. Everything is done fine in the surgery. We, in fact, after the surgery, most of our viewers will be surprised to know that within few hours of the surgery, we make the patient walk. We make the patient stand and walk. They are able to walk. That much we can guarantee. But the problem happens is if they are not serious about the physiotherapy and strengthening their muscles, which has been degenerated or weakened during the process of 10, 15 years of their arthritis, that they have to work on it. And if they work on it, then they can have a wonderful life. Then they can go back to doing any kind of activity. I would say that they can go back to running, playing sports, everything. If they can bend their knee and pray, then they can do everything, except for certain things where impact sports and jumping, where normally we would try to tell them not to do that.
Right. Dr. Sanjay, a question for you. What would be the ideal type of anesthesia if the patient is otherwise fit and he's stable? He doesn't have a lot of chronic conditions where it would affect his body. Is this procedure done in a type of day surgery, as in a procedure where you can do it through local anesthesia or regional anesthesia, not local, but regional anesthesia? Or do every patient require an anesthetic, complete general anesthesia? The reason I ask is a lot of people are fearful. They don't have a lot of knowledge about the subject. So I'm trying to go into the basic details as a layman how I would perceive this topic. And the other thing, Dr. Sanjay, my question would be, second part of this question, if once you have an implant in your body, if you have a prosthesis, are there any restrictions to going to certain specific areas? What about MRI machines, if they need any future MRIs? And what about traveling restrictions? Or whether when they travel, do they need any special kind of permission for this?
Mainly, it is a regional anesthesia. Local anesthesia is not feasible because of the
Absolutely.
They will not be able to tolerate that thing. So it is with the consultation with the anesthetist and their fitness level and the feasibility of the regional anesthesia. Most of the joint replacement are done under regional anesthesia. That increases the pain control, that increases the recovery, and that decreases the complications like pulmonary embolism, and they can start rehabilitation pretty fast. And also that decreases the loss of blood, regional anesthesia. Sometimes regional anesthesia is not feasible for many patients, then that has to be general anesthesia. But that is to be done with the consultation with the anesthetist and patient choice. Some of the patients don't want to hear anything, don't want spinal anesthesia. Then you have to prefer for the general anesthesia, but that is their choice and the anesthetist over there. As a surgeon, we would prefer that patient have the regional anesthesia, which is more preferable for outcome.
Great.
And there is no restrictions of travel. First thing is over there. You get a card, implant card, which you can take along. Most of the implants won't make any noise in the metal screening area because they're non-metal, non-magnetic. Some of them will have the sensitivity for this particular metal will have the alarm going off, but they get the metal implant and they can see the scar with the metal implant and the certificate. They can go anywhere else. And there is no restriction of MRI. Usually MRI can be done with the hip and knee implant.
Right. One more question, Dr. Sanjay. Again, you have been in UK where you trained, where you did a lot of surgeries, and then you moved to Dubai. Demographically speaking, Dr. Sanjay, how different is this region related? What is the prevalence of these knee conditions where the surgeries are required? Is it are they routinely doing it because they want to enhance their lifestyle, or is it a genuine requirement here compared to the West?
No, compared to the West, there is Dubai has got the demography which is different. If you know the demography, we have a left side screw. That means that younger population is a lot more in this country. And the older population is less, so that the expect rate do not live longer here. They go out. But those people who are living here, they have the same requirement of those age group who require a knee replacement surgery. It is same in the West and in here. The population, proportion of population of that particular age group requiring the joint replacement surgery is same in UK and same here. Only thing is that there is less population of that age group in this country, so Normally, naturally, we will have a lesser number of joint replacement compared to the Western countries or back home in India.
But I would like to put
here, and we are doing it mostly.
Dr. Hamad, we
Yes,
all know
yes,
that in this part of the world, in UAE especially, the demography is that 80% of the expats are living in this country. So our people, it is only 20% of the local people who are living, who are expected to grow age, and then they would need replacement. Whereas our expat crowd, which is 80%, well, we by the time we are 60, the insurance is also not there. They travel back home, and so that's why we have less of knee replacements or joint replacement being done here
Do you
because
think
of
there is a
one.
lack of? Do you think there is a lack of education and awareness regarding this knee replacements?
I don't think so. The people do come forward, and they see many of the knee replacements done are out of insurance package. And if they are here and the family is here, they don't want to go back over there. They get it done here. Yes, there is a set subset of populations who is a laborer and who is the manual laborer. They don't have education. They still have the reluctance over there. I have not been able to persuade them, but despite their need, they would prefer going back home because they don't have the social support system. But the different subset, which has got middle class, higher middle class, upper class, they lives here and they have a social support here. They would prefer to get it done here rather than go back home.
I
So
would
these,
like to put into this something, sir, that lot of I would like to general put across a question to my viewers, if they can, the moderator can see what is their what would they want. Like, how will I know? A lot of patients or they ask me, and I'm asking the viewers that how will I know that I need a knee replacement? This is a very simple question, but very meaningful question. That if somebody is suffering, I would say simply that the day you feel, see, knee replacement is not dependent upon what your X-ray is showing, what MRI is showing that your cartilage is worn off, and as we all know that quite a number of times MRI, X-rays will show that your joint is totally destroyed or arthritic, but the patient is not having that much of complaint. So I would say the day you feel that it is your lifestyle is getting affected, uh, and we all know that there is a solution for that. So start, and the day you get up in the morning and your whole activity of the day revolves around the knee, means that you have to take care. Okay, I have to go to the shopping mall. Oh, how much can I walk because of my knee? My knees will be start hurting, so I can't walk. I need a wheelchair. So the day you start feeling that your daily activity of life is getting hampered, or your life starts revolving around the knee, I would definitely say that please don't wait, because knee replacement is the only permanent solution for your joint, and there is no point delaying it. You are not going to gain anything by delaying it. There is again a misconcept which has been carried on for a very long years, that you delay the replacement as long as you can, as if when you are old, you are about to die, then do the knee replacement. No, why should we wait for such a long time? If the implants and technology is available, which makes you, as Dr. Sanjay said, that in young people also we are doing the replacement. So why not get your replacement done and get back to your activity, the full activity, what you want to live a normal life?
The concept of joint replacement advice has changed. Previously, they say that wait till certain period of time so that you don't need revision over there. Now, what we say is that you have a life, you live a pain-free life, leave alone about the worry about the longevity of the implant and the possible expected complications later on, which already published that it long lasting 25 to 30 years, and the revisions, if needed, can be done reasonably well. So there is no point suffering and living like that. The productive life, you have to live productively pain-free. That is the concept right now. We advise everyone who comes with a joint pain, who have reached a certain pain threshold where they have been unable to walk more than 200, 300 yards. They are taking painkillers constantly. They have done physiotherapy. They have done all the intra-articular injection. They have done physiotherapy. If they are still having pain and if they are disabled because of that, and it is hampering their activities, there is no
Dr.
point.
Sanjay, Dr. Sanjay, may I interrupt you for a second? You just said when a patient walks 200 yards, or let's say he walks a little bit and starts feeling pain. As an orthopedic specialist, how do you expect a layman to understand the difference between the pain, whether the pain is in the hip or is it coming to the knee? Because most of the time the pain would be too big and he comes to you and says, I have pain on my thighs. So are there any specific red flags or any specific symptoms
So
apart from pain with walking?
that is a clinical judgment basically, and the patient will say where the pain is. You have to ask the patient specifically point where the pain is, and sometimes the movement will cause more pain, sometimes the rest will cause more pain. There are signs and symptoms which we look for over there. So when they come to the clinic, we looked at the patient, the way the patient walks, and we examine it over there. And then sometimes we have to investigate the hip also, because sometimes the hip pain can come as the knee pain. So that is one of the things which we have to look for. Patients may not be able to guide you properly, but most of the patients are quite accurate when they tell where the pain is.
I would
So
like
I
to
will come
tell,
to yes.
again, we have to tell the patient there are certain precautions. The day you start feeling that you have some knee problem, please don't avoid going to the doctor. Don't live with it. Go to the doctor, get yourself checked, because if you're starting with a knee arthritis in the early stage, there are a lot of things that can be done to avoid, again, I will repeat, to avoid your total knee replacement down the line. If you have really gone to the doctor and listened to him, what are the instructions given to you? There are so many non-surgical options available, and that can be catered, and we can prolong this. I'm saying we have seen, Dr. Sanjay will agree with me, that there are 15, 20 years people have, with the arthritis, they have lived healthy while playing. And so because they know that they have arthritis, but they have been taking care. And on that pretext, I will say that, see, knee depends. There are few things which I would like to highlight for my viewers who are there, that there are certain four factors are there which goes on to convert into arthritis of the knee. If your contour of the knee is different, which means the alignment is different, what is the diet that you're taking? Are you taking a joint healthy diet, which means is your diet containing calcium, vitamin D, collagen, which is very important for your cartilage, for a healthy cartilage? Third is that what is your lifestyle? Have you been doing enough exercise to strengthen your muscles and the joint, to keep the joint healthy? If you're not doing muscle strength in your daily activity, one example I would like to say that in today's world, nowadays, the 90% of my patients, when they come and you talk to them that you have to do exercise, straight away they will say, doctor, I'm doing exercise. What? I'm walking for an hour. I'm walking 45 minutes every day. Where is the exercise you're doing for your muscles? Because of this, they're doing this walking for prevention of your diabetes and hypertension. That helps only in that. That exercise is not good enough to keep your joint healthy. You have to, then I give a simple example that if you're walking for an hour, walk for 50 minutes, 10 minutes you devote to muscle strengthening exercises, which is very important. 4 muscle strengthening exercises, which will keep your joint healthy for a longer period of time. And the fourth category is where people have gone during their life. They have been active, they have been runner or sports person, which because of that they have stressed their knee so much that it has gone into that. Plus also our cultural habits, like when we are praying, whether it is Muslims or Hindu or Christian, we most of the time we fold our leg and we are sitting. We are all the moment when we are folding the knee, the stress is there on the cartilage. So I normally, being a sports person, I don't tell, or especially when they go for the prayer, I say that no, you don't need to pray on the chair. What you do, just try to be a little wise. Immediately after 2 minutes of prayer, don't keep on sitting with your folded knee. You can extend your knee and then you can sit there. Nobody is stopping you from doing that. So it is that cultural thing and the sports and what your life has been, that also leads to this thing. So you have to take care of these things. If you have taken care of these things contour, if you're naturally contour, you can't do anything about that. But at least the diet, you can have a healthy diet which is rich in calcium and vitamins and collagen, which keeps your cartilage healthy. You can always do exercises to keep your muscle strength healthy. And if you have been an active person, you can also prevent by doing stretching or doing the strengthening exercises before and after the sports or that activity, and use some kind of a support in your knee so that it protects from extra stress coming to your joint.
Great,
So these are
great.
very basic things which the viewers should know.
Thank you. No, that was very elaborative. Thank you, Dr. Sanjay. I have a question for you. These knee replacements, these implants, these prostheses, how are they permanent for the lifetime, or is there a time period where they have to be removed or replaced?
Okay. The No, this is not life permanent, but we don't expect them to be revised as sooner. Okay. The knee can wear out, the fixation can fail, but it is not that common. That is one failure point, what we call it. Usually it should last 25 to 30 years. But there are many other factors which is involved in the longevity of over there. So that they're not for life, but you usually do not need revising. If there is a failure, like infection, breakage of the bone, implant becoming loose, then one has to revise it, but they're not that common.
Right. So what happens when the Dr. Sanjay? What happens when the implants become loose? After how long of usage does the wear off come? How much is the depreciation of this prosthesis?
The, theoretically, on the lab and on the patient follow up, they have lasted up to 30 years. Okay.
Okay.
If for some reason they become loose, or if there is wearing out of the implant like plastics, there are various signs like pain, inflammations, instability. Like instability means patient feel unstable in the knee. Then we have to investigate. Patient will not know that what is happening over there. That will be for the surgeons, any surgeons, to find out what is wrong with the implant. So once the knee replacement is done, after 10, 15 years time, when you start having some inkling over there, you need to check with the surgeon. Usually what we normally advise to the patient is that every year get an x-ray done just to check the bone quality, alignment of the bone. See, the implant is okay. Implant is a metal and plastic. It will still wear out, but the changes is not the implant. Changes is the patient's bone, which changes. They are still alive. They changes with time. They can grow older. The bone become osteoporotic. The fixation can fail. Then we might have to revise it.
Can the athlete's life be impacted on knee replacements? Someone who's not a professional but semi-pro, a person who plays a lot of football or cricket, comes to you and he's got some arthritic changes, or he's got some conditions in young age where he requires knee implants or knee replacements. Does it alter his level of exercise?
The longevity depends upon the age where we implant. The older the persons, the implant should last longer because they use less. So it is like with mechanical parts. There is a life cycle there. How many cycles you can use that implant? The machines can run how longer? It is a fixed over there. Like millions of cycle step you can take on that implant. So if you are a younger person, you will use more, you will walk more, you will run more. Running will not make it damage the joint, but the cycle of the stress will have more on the younger population. So they may fail earlier because they are using it more. So there is a fixed life cycle, which is quite reasonable because they are in millions of cycles. So you will not be able to exhaust that cycle if you are using it normally. But if you are using as a sports person, running, impact activities, if you're a younger person, older person may not walk 4 kilometers, 5 kilometers. Younger person will walk 10 kilometers. That will have effect on the longevity of the implant.
Right. Dr. Azam, question for you. After the total knee replacement, is there any changes in the posture of that person or the style of walking?
No, there is no changes. There is no
So,
changes
so he gets back to,
after the knee replacement. It
You
so,
is,
get
so,
back
so
to
you
normal,
can't,
the alignment normal to the original one. When you have
yes,
arthritis, leg will be bowed. We try to straighten the leg to the normal degree. So he will feel that the leg is straighter than before. The walking, he should have it before that he start walking abnormally. But see, we are talking about pre-surgery, pre-disease. He can reach pre-surgery pretty easily. Pre-disease, it is unpredictable. Pre-disease means 10 to 15 years back. You cannot take
yes,
back. You cannot take the person younger.
yes. So exactly the point is, as you asked, no, the alignment, the walking style, everything will be fine. Again, I will like to put it on the patient. Nowadays, as we all know that patient, they have to understand that it is their part also to play in this for a successful, to have their own knee successful and go back to this thing. If they don't exercise, in spite of our telling, keeping them on physiotherapy, and they have to strengthen the knee, if they don't do all those things, they will not go back to the normal what they had, because over the period of time, 10-15 years, during their disease process, their muscles has been affected. It has got weakened. The function has gone weakened. It has got contracted. So to get back those things, it will not happen in a span of few days. It takes few weeks and few months to get back. I'll tell you a simple example. Like quite a lot of people are patients. They will come and ask. For me, especially, they will ask. Normally they would be asking the doctor, when can I drive after the surgery? I would say a simple example. One of my Sri Lankan patient, I did a bilateral knee replacement for him, and he's a fan of cars, and he has a lot of cars and all that. He after 2 weeks, normally I will tell them that after 1 month, depending how your muscle strength is, you can go back and drive. This guy, after I removed his stitches in 2 weeks, and then we normally call him after 2 weeks. So he came to me after the stitch removal in 1 month's time. And then I told him that, yes, you had a very pertinent question. You kept on troubling me about your question that when can I drive? So I said that now I think you are fine enough to go back to driving. Then can you imagine what he's saying? Doctor, please don't mind and don't get angry on me. When you removed my stitch after 2 weeks, that is the time when I drove and went back home. So, so which means that it all depends upon patient to patient and their strength. There is no protocol that you can't walk or you can't do certain activities for this much time. It all depends how much is your muscle strength, how much you're working on it, and how positive you are. You have to be very
right.
positive when you're
Regarding
going in for a
exercise, my question to Dr. Sanjay Sureen, how soon can a patient get back to swimming? Because a lot of people, they go to pool and they prefer doing a lot of pool activities. So how soon can a person swim?
So see the post-operative recovery and the rehabilitation is that after patient is aiming for independent mobility, able to control the knee, stand up from the chair, go to the toilet, go to the kitchen. These are the functions initially immediately after the surgery, we try to achieve that one. And The muscle control takes approximately 2 to 3 weeks, which is with the help of the physiotherapy, and mainly start at the time after the stitches removal. So usually they will gain back the muscle control and independent walking approximately 4 to 6 weeks after the surgery. And as far as the I'm happy, patient is happy, and he can control the knee, and there is a control back of the knee muscles, he can go back to swimming. That will be approximately 4 to 6 weeks in ideal cases. That varies from person to person.
Great,
Ideal
great.
cases,
Doctor,
6 months to go back to swimming.
I would say,
yes.
that with this example which I gave, I feel that once the staples and stitches are removed and they have been vigorously doing their exercises, they can go to the swimming after that also. Third week also they can go. There is once the scar tissue, the incision or the cutting what we have done, that muscle is healed. Once that heals, it takes around when we are removing the stitches in 2 weeks' time. Within 2 to 3 weeks, we are expecting that the healing process has been done about the cutting of the scar. The rest of the muscle strengthening is an ongoing process. But once that healing has been done, then they can do any activity depending upon their strength and their willpower. There is nothing stopping them.
Right, right. We have a question here. A 40-year-old with the degenerative knee disease, diagnosed with osteoarthritis. He's got limitations on his normal lifestyle. What are his treatment options with us, Dr. Sanjay?
See, he's 40 years, he's a younger person. Degenerative changes, we need to assess about his X-ray finding and clinical limitations over there, the physical limitations. And you have to examine the knee over there. First of all, we would try all conservative measures like physiotherapy. If there any meniscal pathology, can it be managed without the surgery like arthroscopy? If need be, physiotherapy, intra-articular injections. If they do not benefit, then we try that if it is possible to just do the arthroscopy and make the life more comfortable for him. If everything is not working over there, all the attempt for the conservative measures is done, then even 40 years is suitable candidate for a knee replacement surgery. But first, we will have to examine him, see the X-ray, probably do the MRI also, discuss with the physiotherapist, give him some medications, intra-articular injections, modification of the lifestyle. All these things will be done before we can proceed with any surgical procedure.
Can I have a question, Dr. Hamad? I see that
Very
it
well,
is
yes.
written, if patient having degenerative meniscal injury and age 40 years, then the second sentence is little worrying me. His all symptoms are of osteoarthritis knee. What does it mean? Is he a candidate of osteoarthritis or is he a candidate of a sports injury? If we are talking about arthritis, we should not use this word of osteoarthritis and at the age of 40 years until unless proven. We should always investigate these kind of patients, whether he has any autoimmune disease, which is rheumatoid arthritis. Does he has a family history of joint issues? Do his blood checkups to find out whether he has rheumatoid arthritis. If proven no, then only we will consider him as an osteoarthritis. And if it is osteoarthritis, that can definitely lead to, there is a word written there, degenerative meniscal injury. Degenerative means that osteoarthritis patient will always have meniscal injury, which is called degenerative. Sports injury patients will have a different, will not be having a degenerative until unless he has been having that injury for a very long couple of years. So that is, first of all, if you will ask me, it is very important to find out whether he has a family history of autoimmune disease or rheumatoid arthritis, do the blood workup, and if he's fine, if we rule out that no, he's, because 40 years is not the age where we talk about osteoarthritis. Osteoarthritis, we talk about rheumatoid arthritis in this age.
Right. Dr. Sanjay, moving on with the same topic. I've heard people say that I have a very weak or my cartilage is small. This is the layman. So either it's small or it's weak or it's not big enough. I think they refer to chondromalacia maybe in the knees. How different is that from arthritis, and what is the treatments for such conditions? The weak cartilages.
Osteoarthritis is the degeneration of there. Chondromalacia is the softening of the cartilage over there. It can be, chondromalacia can happen in the young persons, middle-aged person, but normally wouldn't happen in the elderly people. Chondromalacia is part and parcel of degenerative changes, but it can be because of the injury, it can be because of the lifestyle, it can be because of the genetic, it can be because of unknown reason. It is just softening of the cartilage. Yes. Softening of the cartilage, so cartilage in the layer, white layer of the joint have got some consistency, the different consistency. It is quite pretty hard, but not that hard like bone. So once it's become soft for lack of fibrocartilage or lack of nutrition, lack of minerals, then it becomes soft and it cannot take your weight and it causes pain. So we can diagnose that by doing a scan because it is thinner, it can have a fibrillation on the scan. Clinically also we can examine that over there. It is different from the osteoarthritis. Osteoarthritis, cartilage is destroyed. There is a lack of cartilage, there is a layer of cartilage is missing. Chondromalacia, nothing is missing, it is softened. And it can be possibly reversed in many of the population, many of the patients, not all of them though.
Few questions regarding the injections. There is a trend where a patient comes and says, I was advised injection of steroid into the joint. So my question is, what are the conditions where you inject steroids into the joint, and how important and how beneficial is it? Dr. Sanjay?
Yeah, the steroid injections are basically to manage the pain, decrease the inflammation. And they are very important part of our arsenal to manage these type of joint conditions. And they are beneficial if used judiciously. If they are harmful, if they are used rampantly and again. So what we do is that we inject a locally effective, which is very little amount of that cortisone or steroid is absorbed into your system. We infiltrate it inside the knee joint in a sterile condition. It create an environment of chemicals which decrease the inflammatory cells and chemicals inside your joint, decreasing the pain. Does it repair the joint? No, it doesn't repair the joint. It decreases the inflammation, it decreases the destruction further, so that you can use the joint appropriately. It can be beneficial for 6 months, 9 months, sometime longer. Sometimes, if the degenerative changes where the inflammation is too much, the injection may not do any good to that person anyway. But we do it frequently, the intraarticular steroid injection. It can be done in various joints of the body. It is a God gift to the orthopedic surgeons. It is quite effective when it is used judiciously, but that has to be under supervision of an orthopedic surgeon, and it has to be done appropriately at appropriate patients. Not everyone can have it.
Right.
Can I just put in a word in this? Steroid, as Dr. Sanjay said, it is a God gift to orthopedic surgeon. Yes, there was a time in orthopedics, my father being an orthopedic surgeon, I had seen him injecting steroid right, left, and center for every ailment of a joint. But that stage has passed on, and so we are not totally, we have, especially when we are talking about the osteoarthritis of the knee, I would not inject a steroid if it is a moderate arthritis. I will first, we have these hyaluronic acid, this gel injection, which is commonly said. We have other options before jumping onto cortisone. Cortisone so these hyaluronic acid injections are covered by the insurance nowadays, and we can do that. And plus we have certain other things also which helps in giving the strength. Like we all know, we are talking about platelet rich plasma, PRP. A lot of our patients will come and ask us that what is the role of PRP in this. Nowadays, the moment you take the name of cortisone or steroid, what we are talking about, 90% of the patients, they take their hands off and they kind of, no, this, that, what, steroid. So, but in a way, it's fine also. Like I keep my steroid injections for the last resort. We have PRP injections. We have for the cartilage. The best thing is that bone marrow aspirate, which is a combination of PRP and stem cell. Stem cell has catching up a role, but then stem cell has becoming very popular nowadays, especially for the early and moderate arthritis. They and the days are coming when it will be becoming gradually it is becoming more popular, because the unfortunate thing that it is not covered by the insurance in our country or most of the countries. So that's why it is not getting popularized, or the good effect is not coming. So steroid, we give injection. Hyaluronic acid is very commonly given, which gives lubrication to the joint, and it takes away the painful. I will not say that it takes away the pain completely, but it gives comfort to the joint. It gives a cushioning effect to the cartilage in between. So hyaluronic acid is something which can be always tried before going to the steroid, because after steroid, it is the knee replacement. So step by step, it goes like that.
Right, right. Dr. Sureen, my question for you regarding sports injuries. Can you briefly what is your take? What is the definition of sports injuries, the common injuries of sports, and which areas of the body are commonly affected, and how do we manage it?
See, sports injuries, as name suggests, related to the sporting activities, or any injury which is like a sports injury, which happens normally in the normal daily circumstances, like anterior cruciate ligament injury, shoulder dislocations, meniscal injury in the younger patients, ligament injury, collateral ligament injury, knee sprain, shoulder sprain, wrist sprain, ankle sprains. While doing sports activities, if you get that injuries, that is called a sports injury. But you can have those injuries without playing sports also in the accident or fall. So mainly when you have this type of injury, it will be called as a sports injury, or that particular injury without putting a sports part of that. So usually when you have a sports injury, uh, that depends upon the age group. Some of the sports injuries where there is a ligament tear and the dislocations, you need surgery. There is no doubt about that. Rehabilitation doesn't work. That is some of the things which we have come to the conclusion that, but we need, it is a patient specific, it is not generalized. You have to examine the patient, you need to talk to the patients, what their requirement is, how their lifestyle is. Will that patient be suitable for conservative measures with the plaster, back slap, supportive activity, supportive splint physiotherapy? Many times that will be enough for them to recover. They can, some of the sports injury do recover without any surgical intervention, but there are certain injuries, like I said, ACL injuries, shoulder dislocations, ligament disruptions. They don't
Dr.
heal.
Sureen, when you say surgery, do you mean putting in a camera along with the scope? So is it an arthroscopic surgery?
Most of these sports injuries are treated by arthroscopic surgeries. Very rarely
Okay,
we need to.
great, great. What about shoulder pain? Dr. Azam, common symptom, patient walks in with pain in my shoulder or tells the doctor that for the past few months I feel that I have pain and I'm not able to do a routine lifting of my arm. Is there any specific conditions or red flags?
First of all, we need to know the history and time duration since when he is having this problem. If there is a history of injury, sports injury, let's say he says that I was playing badminton and the next day I started having pain, and after lifting 80, 70, 80 degrees of my arm, I start feeling the pain. Till 70, 80 degrees, he is not feeling the pain. So that is a red flag where your rotator cuff, which is the main muscles which handles your lifting of the hand. So important is, does he has a history of any injury, or how long he has been suffering from it? That will give us an indication that what is the mode and which stage is he gone into. Well, that is the initial thing, and after that we do the examination to check whether it is really could be a candidate of rotator cuff injury. And then we have to supplement it by doing the X-rays and MRI. MRI is the X-ray will not show much until unless there is an impingement. It's a different category altogether. But if you're especially talking about the rotator cuff for a sports person, I'm talking about especially for the sports person who has played any racket sports, whether it is badminton or tennis or even cricket, the bowling, when you're doing the bowling, you're over taking your hand. So in that condition, you will get this rotator cuff injury if it
Are
happens.
these
So
are
MRI
these
will give us the
consultations
whole idea.
are these consultations covered in normal insurance? Because you repeatedly said playing sports. Now I might not be a sports person. I'm not a professional sportsman, but I was playing with my friends and I sprained my shoulder or my
Yes,
ankle or my knee.
yes.
Not a
Recreational
professional
sports are
player.
covered.
Covered.
Recreational sports are covered until unless proven that you're a professional, then it will not be covered.
Right.
That's
Dr. Sanjay,
The answer is yes.
Dr. Sanjay, a question for you. A condition called calcific tendonitis, or in layman's, I had some calcium deposits in my shoulder X-ray. What is this? How do we deal with these conditions? Is it with hot compression, with cold compression, and what do we do?
So the calcific tendonitis is a very peculiar for the shoulder, but it can happen in other joints also, in other muscles. The pathology I would like to explain a bit over there. You you have a lot of calcium in the blood. It is a normal situation, but when the calcium is deposited in the tissue, it acts as a foreign body. It is not your part of the body. Calcium can only exist in the bloodstream or in the muscles, but if it is outside the cell, it is foreign body, and it acts at the foreign body, and your body react to it and start fighting to try to remove it over there. That causes the inflammation, and that is very painful situation. And mainly patients presenting with the acute shoulder pain, if there's no history of trauma, there's two other diagnoses. One is infection or calcific tendonitis. You have to give them quite a lot of pain relief, because that is a situation, it is just before resolving, there will be inflammation. So you have a hope that the next 7 to 8 days this will resolve, but you need to make sure that the pain is subsidized. Very rarely you will need surgical evacuation if it is like a soft calcium, but mostly if you treat it appropriately with the painkillers, physiotherapy, hot fermentation basically is a good thing. With the strong painkillers, it will resolve.
Can I put in
Thank
a
you.
word in that? See,
Please,
Dr.
please.
Hamad.
We are about to wind up, so yes, please,
Yeah.
Dr. Azam.
See, Dr. Hamad, calcific tendonitis, as Dr. Sanjay said, that it can happen in any of the joints. Calcific tendonitis, as he said, that there is a collection of calcium in that part of the body. Any joint already has, apart from the inner side, the outer side. There is an internal, intrinsic and extrinsic. Intrinsic is that cartilage and the contour, whether it is a glenoid joint or any joint, so ball and socket other joints. The joints is held by tendons and the ligaments. And so if the whole space is fixed, it has mechanism, muscle has to move, tendon has to move, anything which comes in between them, it is a space occupying lesion. It is occupying the space and putting pressure around that, whether it can be ligament or the muscle. So it becomes very painful. It becomes very painful because that space has been occupied by that calcium, which is putting pressure around that, causing inflammation all around that. So that has to be tackled. And it can be, so as Dr. Sanjay said, there are so many means of doing it. And most of the time, we don't have to really interfere to take it out.
Great. For those viewers who have joined us late, I would just like to remind you today's webinar was based on knee pain, knee injuries, and total knee replacements, and other sports injuries. We had some great experts sitting today with us in the webinar. We learned a lot. I would like to thank both our panel members, Dr. Sanjay, Sureen. I would like to thank you for your for giving us all this, educating us about all these knee injuries. And also, I would like to tell all the viewers that our physicians are available in Prime Hospital and in Prime Medical Centers. You have to call. You can go online, check on primehealthae.ae. You can contact our call centers. You can directly book appointments. You can visit both of these experts, and we have a lot of other physicians in this team. We are very happy and very honored to have these consultants on board. And Prime is a leader in total knee replacement surgeries in Dubai. And we have our specialists here have combined almost 50 years of experience plus. And Dr. Azam Badar Khan, who's also an expert on knee replacements and other orthopedic injuries. So I would like to inform you that if you would like to consult these physicians, they are available. And we assure you that we give you personalized care personally, and we are happy to bring you this webinar on this platform of Prime Digital. If you have any concerns, you can just raise it on our website. And again, I would like to thank both the physicians. Thank you, Dr. Azam, and thank you, Dr. Sanjay Sureen, for being on the show.
My last statement, take home message is very important for this.
I was coming to that.
I would suggest anybody, please. Sorry, I thought that you were winding it up. Yeah.
No, the mic is yours. Take home message from your side, Dr. Azam.
See, the take home message for our viewers is that if you have any kind of discomfort in your knee, in whichever age category you are, please visit your doctor. Please visit us. Get your knee checked, because as I said earlier, that there are a lot of things which can be done non-surgically. And there are a lot of things that you should do to maintain your joint, healthy joint. And if it is your life is becoming debilitated because of your advanced osteoarthritis of the knee, only and the only solution is that you have to get your knee replaced. Whether you do it soon, if you do it sooner, your life will be happier and you can do all what you want to do in your life. Don't delay it. So as I said, if you're in the early stage, if you have some discomfort, don't hesitate in going to a doctor, getting your knee checked. Follow the do's and don'ts, do your exercises, do your diets. And if it is in an advanced stage of osteoarthritis, injections and everything you can try, but the final treatment and the permanent treatment is knee replacement. So you have to take a call if you want to live a healthy life after that.
Right.
Thank you.
Right, great. Dr. Sanjay Sureen, your kind words, please, sir.
We have expertise to manage all the conditions. And if you have any problem, approach us. We are approachable. And then I'm sure that we will be able to help you somehow. Not everything is surgery, so there is no harm in approaching us.
Absolutely. Viewers, I would like to tell you that Dr. Sanjay Sureen in particular is very approachable, very detailed person. So I assure all of you, whoever visits Dr. Sanjay Sureen will be very content with his treatment plan. Dr. Azam Badar, again, very intellectual, very calm, and I am sure that with his expertise, he will be answering all your questions. So please feel free to contact us, get your appointments. If you have knee pain or any pain in any other joint or muscle pain, these are the right people to see for your musculoskeletal conditions. Going with this, thank you again. Thank you to Prime Management to give us a chance to come forward and reach our audience. Thank you to the Prime Digital team who arranges all these webinars for us. And Prime Hospital, again, we are part of Prime Hospital. We are very proud to be part of Prime Healthcare Group. Thank you very much for joining us this week, and we will bring you more specialists soon. Stay tuned, we'll be back.
Thank you. Thank you. Thank you, Dr. Ahmad. Thank you, Dr. Sanjay. For the viewers, please